Michael, where you been? Rest of us, the press corps has been working, you know. Does your boss know? I mean, the other part of the News Corp empire has been here every day, as I remember. Is that fair to say? You weren't in Palm Beach, were you? Good. Well, good afternoon. At the outset, let me thank Lincoln Medical Director, Dr. Melissa Shorey, and William Hicks, the hospital's Deputy Executive Director, and everyone at Lincoln Medical Center for hosting us today. This happens to be one of the busiest hospital maternity departments in New York City. On average, about 50 babies are born here every week of the year, and we've come here today with glad tidings of the season, particularly for newborns. Today, newborn New Yorkers can expect to live longer, healthier lives than ever before, and also live longer than if they were born and lived in many other parts of America. In fact, starting about 10 years ago, and let me show you the first slide here. Where is the... There we go. Starting about 10 years ago, after nearly a century in which life expectancy in New York City was almost always less than that in the U.S., life expectancy at birth here began exceeding that of the nation as a whole, and you can see that on this graph. This goes back to 1990, which this did work before. There it goes. Why can I not see this?
1901.
1901, yeah, but there it is. It's just hard to see on that graph. This is back to 1901, and here we are, 1909, the last year we have data for. And you'll notice that New York City for females and New York City for males has always been less than America. This dip I'll explain later on. But here, starting in about 2000, the lines crossed. For the first time since 1901, life expectancy in New York City is greater now than it is in America. So if you have friends and relatives that you deeply care about and they live elsewhere, on average, if they move to New York City, they will live longer. The next graph shows this in better detail. This is the last 10 years from 2000 to 2009. And life expectancy of a baby born in a city has reached a record high of 80.6 years. And that's based on statistics through 2009. The life expectancy is nearly 3 years longer than it was in 2000. For a new baby born, it has gone from 77.6 to 80.6. And life expectancy is also up nationwide, but only 1.4%, from 76.8 to 78.2, about half as big as increase. So you can see this is where it was, this is where it is, and the difference is 2.9 years. The average person in New York City born in 2000 had a life expectancy of 77.7. Today has a life expectancy of 80.6. America's gone from 76.8 to 78.2. That's good, but it's only gone up 1.4%, while New York City has gone up 2.4%. So not only has New York expanded faster, it is now beating the country by a record margin. Now, the next one is to show you that this is true for males and females. Actually, males have improved more than women, but women still have a dramatically higher life expectancy. They always have, and just continues. This is the United States. This is this is New York for females, males, United States, and New York. And you can see the difference. Women, on average, born today, will live to 83 years old, and in New York City, and males to 77.8. So that's a pretty big difference. If you're a male, it's not good news, but we're catching up slowly. Recently, a group of researchers calculated life expectancy gains in every county in America between 2000 and 2007. So these numbers aren't quite as current as the data we've been looking at, which goes to 2009. And let me show you those tables. This is life expectancy at birth, first for males. And what it says is that in the 5 counties up to 07, life expectancy was 77.6, a 4% increase. Now, there are a couple of other places where it is higher, in Washington State, which includes Seattle, in Santa California, which includes Santa Clara, which includes San Jose, which is 80.6. But basically, we are, Orange County as well, but we're right near the top, and our change is greater than any place else. And the same thing is true for females. Our change is up 3%. Remember I said males were starting to catch up, but very slowly. But if you take a look, there are some others right about the same, but our change is greater. So we're going in the right direction. Now, one of the things that is interesting is, if you look around this room, nobody here is a baby. So all of you should be asking the question, that's for babies, what's life expectancy change? What happens if I'm 40 years old? An average of probably the people in this room. And here's what that shows. This is for 40-year-old. If you're born at the date along the bottom, what is your life expectancy? And New Yorkers grew by 2.5 years if they're 40 years old. If you were born in 2000, you were going to live another 39.5 years. Your life expectancy if you were born in 2000 would be 40 plus 39.5.
If you were 40 in 2000.
Pardon?
If you were 40 in 2000.
That's why I said that. If you're 40 in 2000, you were going to live 40 plus 39, or just 79.5 years. Today, today, in 09, if you're born at 40, you're going to live to 82, 40 plus 42. The United States, fascinating thing, is in the United States as a whole, life expectancy for 40-year-olds haven't changed in the last 6 years. We're not quite sure why that is. We can tell you why life expectancy has gone up in New York City. But this is really something that the country should be worrying about. And Tom thinks one of the big things is obesity. Obesity really is something very damaging. Cancers and heart disease and diabetes, lots of things come out of being overweight. And if you're overweight, chances are you also don't exercise, and chances are you eat a lot of things that aren't very good for you, as well as putting on weight. But the bottom line is the country from 2000 to 2009 went up 1.2 years. New York City went up 2.5 years. And incidentally, for 40-year-olds, you will live 1.9 years more if you live in New York City than if you live in the country as a whole. Now, I have a different question. I'm more concerned what happens if you're, let's say, 70 years old. For very selfish reasons. Once again, no change in America. Once again, a big change, 1.5 years, and about half of that, 0.7 years, in the country. I still will live, on average, 1.8 years more by living in New York City than if I lived in America as a whole. All of these numbers are things that nobody ever thought you would have. Think about this, because New York City, big cities, we always talk about crime and fires and traffic accidents and the pace of life and pollution and all that sort of stuff. The truth of the matter is, over the last 10 and actually going back a good 20 years, in New York City, we've really started to make a very big difference in those kinds of statistics. And it really comes home when you put it all together. Now, we have some more good news. In addition to this information about life expectancy, the City Health Department has also updated information on specific mortality trends through 2010. And it shows that we've achieved a historic low figure, and that means a lot to everybody in this maternity department, and it should mean an awful lot to all New Yorkers. Our infant mortality has also reached an all-time low. In 2010, it stood at 4.9 deaths per 1,000, the lowest rate since the modern city of New York was created back in 1898. And these trends and more are all included, incidentally, in the city's new 2010 Summary of Vital Statistics. It's being posted today on the city's website, nyc.gov. Now, our next slide takes a look back to 1990, because this is, remember I showed you on that first graph, you had that dip in the 90s. Why does the dip? Here's the reason. HIV skyrocketed, and the deaths from HIV skyrocketed. But then, about 1995, medicine really made some dramatic advances. And so the deaths from HIV, not the HIV rate, but the deaths from HIV plummeted. Also, the other big change was homicides. They came down dramatically, remember, starting in the 1990s, and then we've continued to reduce them, but the big decline, remember, was back then. So that explains why you had that big dip in the 1990s, but after that dip, it came back to what was the norm in the country, and then this is what's happened since then. And if you take a look, we continue to bring down cancers, and heart disease, and infant deaths, HIV, all of these. The trends are down. The trends are smaller because the big change was back when. But every single one of these added together gives you that 2.5 years longer that you'll live if you live in New York City on average. Now, we've seen decreasing rates of death in all 7 of these categories: HIV infection, heart disease, cancer, drug overdose, homicides, traffic accidents, as I mentioned earlier, infant mortality. They account for more than 3/4 of the improvements made in lifespan. 30% of the gain is due to, in the last 10 years, is due to a big drop in HIV-related deaths. Between 2002 and 2010, the mortality rate from HIV infection decreased another 52%, and that's the most dramatic decline in any cause of death in our city, and as a result of our aggressive efforts to treat for and to test for and to treat HIV infection. Another 15% or so came from the years of life, increasing the years of life is due to decreases in death from heart disease, down 28% since 2002. A big factor in that decline is our multi-pronged effort to discourage use of tobacco. Since 2002, we've helped nearly 500,000 New Yorkers quit smoking and lengthen their lives. Fewer cancer deaths accounted for about 12% of the increase in our years of life, and the fact that many fewer New Yorkers are smoking and that many more are being screened regularly for cancer, something else that is very important, particularly breast and colon cancer, where the earlier you catch it, the better chance you have of doing something and having a good outcome. Another one of our citywide public health initiatives really are the big reasons for the drop in cancer deaths. Better policing, stricter gun policy, and better transportation engineering enforcement have led to fewer homicides, fewer fatal drug overdoses, fewer fatal traffic accidents, which together accounted for nearly 20% of the decline in the years. And the NYPD has decreased homicide in our city by more than 20% in the past 10 years. Drug overdoses, you should know, went down 24% between 2000 and 2010. And later in this week, we're going to talk about the decline in traffic fatalities, which are, incidentally, at a new all-time low. Before introducing Health Commissioner Dr. Thomas Farley, let me just add this. While the numbers show that New York is moving in the right direction and becoming a healthier and safer place for us to live and to work, we do have a lot of work still to do. The fact remains roughly 15,000 New Yorkers died last year before reaching the age of 65. Heart disease, cancer, influenza, pneumonia remain our leading causes of death overall, followed by lung disease and diabetes. And going forward, we've got to continue focusing on reducing deaths from these and other causes through better preventive care and by continuing to give all New Yorkers, including the infants in this maternity department, a healthier, safer life. The bottom line is, for all of these little announcements, all the times we talk about making differences, in the end, they really all add up. And just think about that, almost 3 years more for the average person living here than what they did before. Can you imagine if it went in the other direction, the devastation it would be causing in our society? It gives lots of things. Let me give you another fact. The statistics that we've given you for life expectancy do not assume any improvement in medicine. and in other public health care initiatives. If you were to take a baby born today and assume that all of those things that we've done over the last X number of years to improve life expectancy would continue to be done at the same rate, a baby born today has a 50-50 chance of living to 100 years old. It's really quite amazing. Tom, you want to talk about what's going on here?
Thank you. Oops. So, societies have been collecting and analyzing statistics on birth and deaths for about 150 years. And that's because vital statistics like mortality rates in adults and infants and life expectancy are measures of a society's health, not just in the medical sense, but also in the broader sense. And that's because social problems invariably lead to health problems. Adverse conditions in the workplace, in schools, in neighborhoods, or breakdown of the family all ultimately make people sick. Now, life expectancy has been rising steadily in the United States and New York City for over a century, as you just saw. The continued gains show that for all of our current problems, life is better than it used to be. In the last decade, life expectancy has been rising particularly quickly here in New York City. And the fact that New York City's life expectancy is greater than the U.S. and rising faster than the U.S. means we're doing something, or some things, right. In the narrow sense, we can attribute most of our gains in life expectancy to reductions in the 7 problems that the mayor listed: HIV disease, heart disease, cancer, drug-related deaths, accidents, homicides, and deaths in infancy. But underlying those improvements are many changes in the city, such as lower smoking rates, better obstetric and pediatric care, and healthier mothers, and streets that are safer from crime, transportation accidents, and drug trafficking. Now, the health department can't claim credit for all of these, but the city government can claim credit for many of them. And regardless of credit, these statistics say more than anything that this is a great time to live in New York City. We still have far too many preventable, premature deaths in New York City. Much more needs to be done, but the statistics today say we're definitely headed in the right direction.
State Senator Jose Serrano. Jose, you want to?
Thank you very much, Mayor. It really is fantastic news to see what's going on here, and I can't say that I'm really surprised. It seems like every time I pick up the phone, the mayor's office is calling to say, would you like to join us on a workshop on trans fats? Would you like to join us on something regarding green, healthy foods in the community in East Harlem and in other places? So I think this holistic approach that this administration has taken, coupling that with smoking cessation and other educational programs, are really starting to bridge that gap. And this hospital, I think it's great that we're here, because Lincoln Hospital has always been at the forefront in bridging the gap in health disparities in communities of color. So when you look at that entire range of things that have happened, it's no, I guess, mystery that New York City is one of the healthiest places to be. I think probably the healthiest place to be anywhere. And on a personal note, a week ago today, my wife gave birth to our daughter. And I think that it's so wonderful that we're here talking about life expectancy, because I want nothing best than for my baby. But I think that it really is exciting to see how trends have changed over the years, and I feel so proud and so fortunate to be raising my 5-year-old son here in this neighborhood and my infant daughter in this neighborhood. My wife and I really do see the difference in the way that health outcomes have become commonplace, and I give a lot of credit to this mayor and to this administration, health commissioner, and to this hospital for making that holistic approach happen. Thank you.
Jose, thank you. Let me point out that all of this comes under, an awful lot of this comes under Linda Gibbs, our deputy mayor. And Linda, you should be very proud today. And also, let me add that the preventive care provided at Lincoln Medical Center and other public hospitals and clinics is a big reason why New Yorkers are living longer, healthier lives. It's helped more New Yorkers keep their blood pressure under control, fend off diabetes, and quit smoking. And I do want to say thank you to everyone at Lincoln for all their efforts to help New Yorkers stay healthy. Before we take questions, let me just try to summarize for our Spanish-speaking New Yorkers. Hoy nos alegra afirmar que el promedio de expectativas de vida de los neoyorquinos es mejor que nunca y además queda a casi 2 años y medio mejor que el promedio de la nación en total. El índice de mortalidad en la ciudad está en un mínimo histórico, así como la tasa de mortalidad infantil. And with that, we'll be happy to take some questions